like we're good. So now I want to mute this, right? Wait.
Yeah, you want to mute your YouTube video that comes up.
Yeah, where is the mute? Oh, over here.
Yep. If you hover at the bottom, it'll have the pause, play, mutes.
Okay. That's all right. I'm good.
Yep, you're live as long as you're not getting any feedback.
None.
All right, it's 5:30. Shall we go?
Sure.
I'm going to go ahead and call to order this meeting of the Dunn County Health and Human Services Board for May 21st, 2020. Welcome, and let's see how we deal with this meeting format. Welcome to the people who are participating in the meeting via our live feed. We will not be having public comment in this format. Hi, everybody. I'm Diane Morehouse. I'm your new chair and also a new committee member. So I hope that you will all, colleagues, be patient with me as I get up to speed on this. I'm going to go ahead and do a formal call of the roll just because we need to do a couple of things because we are all new. So if you don't mind, Larry Bjork.
I am here.
Sarah Kennedy.
I'm here.
Bill Lamb. Absent. Bonnie Barker.
Here.
Sarah Schaefer.
I'm here.
Hi. Gary Steen.
I'm here.
Diane Morehouse, I am here. And Jody Cromery.
Here.
Hi. We're probably not going to do this again, but since we don't know each other, I thought it would make some sense for each of us to go back for like a tiny minute and restate your name, define your role on the board, what constituency you represent, and how long you've been on the board. We won't do this again, but just so we get to know each other, and I'd like the staff to introduce themselves as well. Supervisor Bjork, do you want to start?
Yeah, Larry Bjork, Town of Springbrook. This is my third term. I'm a dairy farmer, or ex-dairy farmer that's a truck driver and have beef cows. And I get to wear my bibs at a county board meeting. Thank you, Diane.
You're very welcome. Gary.
Gary Steen, I represent District 5. I'm a county board member. Been a member of this committee since around 2010 or 11, I believe.
Jody.
Jody Cromery, District 13, very recently elected to the board. During the day, I work at 3M headquarters in St. Paul, and I live in North Menominee.
So I'm Diane Morehouse. I represent District 21, which is essentially Ward 9 in the city of Menominee, and this is my third term on the board. Chairman Bartlett.
I represent District 2, northwestern corner of the county. And this is my 11th term on the board and my second term as chairman. Thank you.
Bonnie.
I'm Bonnie Barker. I'm a citizen member. I've been on the board since 2017. In my real life, I'm the director of special education and school psychologist in Boyceville.
Thank you. Sarah.
I'm Sarah Kennedy. I represent District 22. I was a 37-year Dunn County employee, and now I've been on the board for 5 terms.
And Sarah Schaefer. Sarah Schaefer, can you hear us?
It looks like.
Yes, can you hear me?
Yep. Yes. Yes.
Can you hear me?
Yeah.
Okay. I've been a citizen member since 2018.
I think she has a bad internet connection.
Yeah, I think we're having some issues. Both your video and audio sort of lock out on us.
Okay, can you hear me now?
Yes, excellent.
Sorry about that. Citizen member since
Oh, geez.
Lost her again.
2018.
We're still having some issues with you. Well, not with you, with with your tech.
You've got legs, Sarah.
Well, let's go ahead. Um, Chris Corpola, would you like to introduce yourself?
Sure. I'm Chris Corpola. I'm the Human Services Director. I have been in this position since 2013.
Thank you. KT?
Good evening. My name is KT Gallagher. I'm the Dunn County Health Department Director. I have been in my role here for just over 2 years.
Thank you. Greg?
Good evening, everyone. Can you hear me okay?
Mhm.
I've County Veteran Service Officer, been in my role since about 9 years.
And he has a personal chauffeur.
I'm actually sitting in the Walmart parking lot right now.
We were going to ask you why you were in your vehicle.
Well, if you ever watch Manitowoc Minute, you can look at the Target one. That's kind of what I'm doing right now.
Okay, Christine?
I'm Christine Kistner, and I manage the economic support section here at Dunn County. I've been doing this since 2012.
Terrific, thank you. Sarah Stabenow? We can't see you.
No, I'm sorry, I don't have video, but my name
Okay.
is Sarah Stabenow. I'm the accounting manager for Dunn County, and I've been in my position since 2012.
Okay. And Krista, do you want to participate or not?
Sure. I'm Krista. I'm the
Lovely.
web support specialist for the county, and I am just here for technical support.
And
for
we
you guys.
appreciate it. Thank you very much.
Yes. You're welcome.
Okay, thank you, everybody. I look forward to with our our work together. Item number 3 on the agenda is approval of the minutes from March 19th. You have those minutes in your packet.
I so moved, Diane.
Move approval. Supervisor Steen, is there a second?
I'll second.
Sarah Kennedy seconds. Motion and second to approve the March 19 minutes. All in favor?
Aye.
Aye.
Opposed? Minutes are approved. Thank you very much. Item number 4 is review of the next meeting date. I know that this third Thursday and 5:30 timeframe is long-standing for this committee. Does that still work for everyone? The next meeting is tentatively scheduled for Thursday, June 18th. Anybody have any issues with this? Okay, let's, I'll assume that June 18th works. Put that on your calendars at 5:30. And I guess for the moment, we should assume that it will be a Zoom meeting, but obviously we will keep you apprised of that. Okay. Item number 5 is agenda items placed at the request of the chair, and probably because I'm a newbie, there are a couple of items that I wanted us to talk about. One, since the COVID-19 pandemic has kind of uprooted everyone's work, I specifically asked both KT and Chris to give us a kind of an overview of the extent to which the pandemic has changed, influenced the operations of the department. And I know that it's probably a long story, but to the best of your ability, can you give us some sort of sense of how this has affected your operations?
Sure, I can start. Let me find, I'm going to quick share my screen. I can actually send this out afterwards as well. I think it's this one. So this was a little report that I put together for on the county side, and then I shared it with Supervisor Steen last month since he was the board chair. But essentially kind of does a little run through of where things are at with our agency. Essentially, we were in a really good position to move our staff out to work remotely. We have about 95% of our staff. There's about 90 of us, and there's usually on average about 8 to 10 people in the office on any given day. So 90% of us are out working remotely. We had purchased a ton of portable laptops and things last year with some grant money, so that had positioned us really well to be able to move things out. Staff are, for the most part, have accommodated the changes pretty well, as well as the consumers. We're delivering pretty much everything, almost everything that we used to deliver in person, electronically, whether that's by video or by phone. The only probably significant change that's occurred is that we did close our congregate meal sites in our senior nutrition program. And we did move those to just people could do pickup at the restaurant sites if they needed to, or they could do pickup at one of the Meals on Wheels. So we pack meals out of Tantera apartments in Menominee, and we feed about 12 or 13 or 14 people at Tantera. And so we just, they package their meals and they just take them back to their rooms. Same thing at Hosford Rich Apartments. They still pack the meals there, but then someone from Hosford Rich delivers them to each of the rooms. We have moved from about, I realize now that I'm going to show you a report in a minute, but in a little bit, but we've moved from about 90 110 Meals on Wheels participants a day to about 130. Partly that's because the state expanded the definition of or eliminated the requirement that you be homebound. Once they recommended the closing of congregate meal sites, they said we could serve people who had previously been served in a congregate setting through home delivered meals. So that has bumped our usage by between probably 20 and 30 meals per day. But in corresponding change, that has been one area where there's been a pretty significant amount of funding that's been flowing through to accommodate those changes. So that program has been able to reap some financial reimbursements for the additional work. Otherwise, I think we're kind of doing what we do. Probably the most impacted group have been our little kiddos who are in out-of-home placements, who for a couple of months now have not been able to do in-person visits with their families. We're just moving to some in-person visits with them under some fairly restrictive means, which is really hard, especially for those little kiddos that are like under 2, who just don't do that well with video conferencing and things like that. So, but that's starting to slowly change. Hopefully it doesn't have to change back, but that group was really significantly impacted.
Thank you. Thanks very much. KT. The health department has obviously been enormously impacted.
Absolutely. So everything that we do right now, almost in its entirety, is related to COVID-19. So we have moved into a modified ICS or incident command structure that really puts us into different work groups to address the different needs around COVID-19. So the public health department has, I'm sorry guys, my light is on a motion timer. Yeah, so all of our team is working to respond to COVID-19 with some very notable exceptions. So our funding that comes through the state and the feds oftentimes has very specific parameters on what it can be used for. The federal funding that is passed through the state to support our WIC, or Women, Infant, Children program, which is supplemental nutrition, is specific to that program and cannot be reallocated or reused for anything else. And so our public health nutrition manager and our public health nutrition tech are both still continuing to do WIC work, which is actually very much COVID related. We are seeing a significant uptick in usership because as people lose their ability to lose their income, they have the ability to use that benefit. The WIC program itself has been incredibly responsive. They have moved to, at a statewide level, not require in-person visits, which has really removed some of the barriers to usage. They are also piloting some technology to where they are doing more online and through technology to use those visits as a more personable interaction. And so they have been kind of forging the way in a way that I didn't expect from a federal program. So that's been fantastic. Environmental health, they have been pulled out of restaurant inspections, out of well inspections, out of their routine work so that they can help respond to complaints around COVID-19, as well as to help us with messaging. All of the nurses have a public health response role in COVID-19. 4 of our nurses have full-time contact tracing jobs where they are contacting both the negatives and the positives, and then working through the contacts associated with the positives to reduce and limit transmission to secondary cases. Let's see, one of the nurses is working almost exclusively with preparedness. And so what that means is she is working on our plans and policies and procedures to make sure that we're set up to implement isolation and quarantine when we have somebody who's COVID positive that is insecurely housed. Or work with our school districts to update our MOUs and contracts to have my name as well as the superintendent. I think we had one superintendent that had passed away. And so we obviously needed to update that one. But so she's working to go through from a preparedness lens to make sure that we're ready to address COVID-19. And then we have 2 admin professionals that, again, have been redirected. One is working almost exclusively with our WEDS system, which is the Wisconsin Electronic Disease Surveillance System, which is where we get our information in on positives and negatives, and getting those assigned with me to different nurses and managing that data regularly. We still continue to see some folks for reproductive health. It is very important when people are stuck home without much else to do that they have adequate access to contraceptives so they can make informed life decisions that will impact them long term. I see you laughing, but it's true. And then we do some TB screening. So if you are going into a drug treatment facility or you are working in healthcare, you're oftentimes required to be screened for TB. We continue to provide that service so that we don't have a backlog. And then we will provide some immunizations if somebody is in need of a tetanus or a pertussis, since we still do have clusters of pertussis or whooping cough going on right now in the midst of COVID-19. We will provide that service as well. But predominantly, not only have we been redirected, but we are increasing our hours. So many of my nurses are now working overtime. Many of them are not working just 5 days a week, but are working 7 days a week in some capacity. We have also brought in a couple LTE nurses to do contact tracing. One is a recent retiree, so it's like riding a bicycle. And then another one is a community partner from Stout, who in her history has worked as a public health nurse in an adjacent county. So we are expanding our capacity and diverting our staffing to maintain capacity, specifically as it relates to public health's role in response and containment of COVID-19 in Dunn County.
Thank you. Any questions for either Chris or KT?
Yes, Madam Chair.
Go ahead, Supervisor Steen.
KT, after listening to you, it would appear that almost all of your activities are COVID related. My question is, are we able to claim any of this time and translating into money spent on this?
So I think that's a fantastic question. We are time tracking using our electronic medical record system, Nightingale Notes. We are making sure that everything that we can get reimbursement for, we do. I think there is still some guidance yet to be put out around what we can recoup costs that is levy versus unusual costs that were not already budgeted for. And I can talk a little bit more about the money of the situation when I talk about where we are and where the state is with COVID-19.
Thank you very much, KT. Any dollar you can get would be appreciated.
Any other questions? Greg Quinn, can I put you on the spot with the same question?
Yes, ma'am. So the Veterans Office, we're running split operations. I'm working out of the office and handling some of those more critical face-to-face appointments. One staff that's working from home, so I'm able to feed stuff. She's able to print, so we can still continue forward with helping with disability claims, medical record reviews to support our veterans. It's certainly been a little bit more challenging. You know, I certainly see one of the most obvious financial savings is in mileage. You know, just one simple example. We have a small budget, but probably close to about an $800-900 savings just in not going to a conference that was canceled. And their VA is looking at alternative methods for us to gain our continuing education credits to be able to do the work that we do. So things are a little bit different, few extra steps with using mail, conference calls to take care of things. But I think for the most part, we've got to be pretty fluid and flexible at all times anyway. So it's working okay right now, and hope for the future that we can get more of our older veterans back in, because when they're hearing impaired, it's a little bit more difficult to accomplish some stuff. So that kind of ends my update regarding some of how we're dealing with the COVID.
Great, thank you. Any other questions?
I have a question.
Yes, Supervisor Bjork.
Greg, it's always been a big part of the medical part of the veterans is the transporting to Fort Snelling or wherever they might go. How's that been affected? And are you feeling confident that you know, everybody's being kind of protected during the transport, or how do you come down on that?
So the elective type care has been reduced. So the VA has restricted a lot of some of the activities that they're doing medically. So it's just the most important items. So the travel has been reduced greatly. And so I can say the last month, it's been very, very limited. And honestly, it's coming down to the individuals to choosing not to put themselves in harm's way as well. And so couple other things, the VA changed last year in 2019 with a program called the Mission Act that's allowed more community care. So it's allowed a lot of veterans to be able to be a little bit more self-sufficient within their family to get those shorter medical care transports to the Eau Claire area, working with Marshfield and Prevea Health. So does that answer your question?
Yeah, it really does. It's just that, you know, you always hear about how, you know, veterans being transported for medical care to the VA, and I guess the local stuff is good to hear. Our local response is good to hear. It's just that, usually if you have a problem, the problem doesn't go away just because there's a bigger problem out there.
Thank you. The second item that I asked to be placed on the agenda may only be an issue for me, as I've spent time in the last couple of weeks, excuse me, trying to get up to speed on these areas that are, obviously of critical importance and also pretty complex. So I am wondering what the board might think about considering doing some kind of, call it ongoing professional development, some kind of, details, of course, to be worked out, but some kind of session at each of our meetings that would acquaint us with, for example, how the health department's communicable disease surveillance program is supported, or some of the kind of ongoing issues affecting behavioral health. And again, I say, it might simply be me, but I'm wondering if, with a reasonable focus on time and an appropriate way to do this, if the board would be interested in kind of beginning some kind of ongoing professional development. I throw that out to you. Anybody care to weigh in?
Diane?
Yes, Supervisor Steen.
It's been my experience in the past that both Chris and KT and anybody involved is more than willing to explain things. If I'm following you right, maybe you are thinking of one department a meeting or a quarter to get us up to speed on what's going on. I've been on the committee for quite a few years, and it's confusing. It takes a while to understand everything. And so I appreciate where you're coming from, and I'm in favor of whatever you or Chris or KT would think would be appropriate for not only new board members, but also older board members that we soak up some stuff by osmosis, but it doesn't hurt to have some education either,
Thank you. Any other comments?
I think it would be a good idea. I've been participating in these meetings now for about 2 years. And I know there's a lot I don't know. So I wouldn't mind hearing some of that. I think it's a good idea.
Thank you, Chairman Bartlett. Anybody else? Well, without objection, would you allow me, working with Chris and KT, to think about an approach, and we'll give it a try and see how it works?
Sure. Sounds good.
All right, thank you. Third item that I placed is it's getting on budget time, and I would like to have a very quick review of budget process and our timeline for doing so. I don't know, Chris, do you want to take this one?
Sure. Well, I thought I had it at some point in time, but I don't know what I did with it. Okay. I can just do it verbally. So we are in the midst now of preparation of the first round of the 2021 budget, initial budget submissions. We're doing that with obviously with a 0% increase in expenditures on the operations side. And the first round is due to the finance department by the day next Friday, the 27th, something like that. Something like that. Yep, 28th, I guess.
28th. Yeah.
Maybe it's even the 26th. I don't know. Next week sometime. Then the CFO and the county manager will kind of go through those and begin to sort of tally where we're at from a county-wide perspective. You actually, and then those all get compiled. For those of you who've been on the board for a long time, you'll know those all get compiled into a comprehensive budget document or book with all the departments in it. You'll be provided those in July at the July County Board meeting, and then we will be asked to do a budget review meeting in August. So that'll probably be our regular meeting. It does take a little bit longer time sometimes than our regular meeting for us, and we're still sorting out exactly, kind of waiting. So we have a requirement that we also incorporate public comment into that process. And so it gets noticed as a public hearing. But obviously if public can't show up, we'll have to think about how that's all going to look. So I think all of the counties are currently waiting to determine, what access will look like at that point in time for public. Now, practically, we've noticed it for public hearing forever and no one ever comes. So I don't know that it's a huge issue, but if you're going to put out a notice that you're having a public hearing, you have to be ready to accommodate the public in some capacity for that. So we'll be sorting that out over the next few months, but you will get a review of the budget for each of the 3 departments and opportunity to weigh in and ultimately recommend forwarding that on for further consideration at the August meeting. From there, all the standing committees review all of the budgets in August, and then they are all forwarded to the executive committee, who begins the kind of arduous process of looking at what the requests are and what the amount of funding is available. Obviously, this is going to be a very, very interesting year with lots of unknowns, and then they will continue to work through that process over the fall. And then with the ultimate goal of having essentially a somewhat semi-final document for the October County Board meeting, with the goal of then bringing it for final approval at the November County Board meeting. So it's always been a process of trying to not leave last minute things until the very end and changes, and try to bring forth a kind of a collaborative document for the board to approve finally in November.
Okay, thank you. Any questions about the budget process? Okay, moving on. Veteran Service Office report. Greg, in the interests of this format and time, we're not going to review written reports. There were written reports from Greg in your packet. They were excellent, as was, by the way, your annual report that went to the county board last night. So I'm wondering, since that was in your packet and you've had a chance to review it, if there are any questions of Greg or any comments. If not, Greg, I'm sure you have some things that you would like to share with us. Please go ahead.
Thank you. The first thing is I would ask that everybody, if they can, go to the county's YouTube site and look at Memorial Day video that was just released yesterday, and that's a alternative method to celebrate Memorial Day. It was put together by staff in office, Jessica Stark, and I think it was done very well in coordination with the Menominee Patriotic Council. Of course, there's varying feedback on it, but in the end, and thinking of safety, I think it ended up being a tasteful Memorial Day recognition. So I just encourage everybody to look at that and gather. I'd welcome to any feedback. Thanks for the comment, Krista. The next thing, sometimes things move quite rapidly, and we were approached a couple weeks ago by UW Extension covering Pepin, Buffalo, and Dunn County to partner on an innovative funding grant. So they put together a justice system jail reentry outreach grant that went in. The total amount's $13,905. We have in-kind match that was in on it. I'll have to get that on as an action item for next meeting, but packet was already submitted prior to this all happening, and I can distribute the actual write-up in the grant. And I think it could be a definitely beneficial thing for those that are entering the justice system or those that have potential to enter the justice system and those coming out. Another update is I'm on the agenda for the Facilities Committee to present a location for the Veterans Eternal Flame that's going to be relocated, redesigned, coming from which is now the City of Menominey's building. And I think there's a nice nice design that's been put together up to this point, working with a number of other members. All of the flags went out on all of the graves. Our volunteers did a great job putting them out, and we still field quite a few calls on some missing ones which we're reacting to. So that part of Memorial Day and that has all went forward without any hitches. So I'll end with those updates and pending any questions that you have.
Thank you very much. Questions, Chris? Yeah? No.
Nope.
Okay, moving along. Item 7, Department of Public Health Director's update. KT, it's in your court.
Yeah, thank you for the opportunity. So typically I do like to prepare a written report for you, but my time has been pretty scarce. So what I will share with you guys is my screen for a couple quick things about COVID-19. I've already shared a little bit of a situational update about what the department is doing, but I'll just put some numbers to that really quickly. So let's see if I can, oh, I can't share my screen. Never mind, I'm not the host.
You can, I can make you.
I just changed those settings,
Okay.
so you should be able to do it now.
Okay, awesome. All right, so what I'm sharing with you is, can you guys, is it centered or not quite?
No.
Not too bad though.
So what this
There
is
you
a
That's better.
situational report for COVID-19. Somebody in my staff does this weekly, and it just gives a breakdown of how many cases we have, how many negative tests we have, and then some other supporting information. So I just want to talk through this just very briefly so you guys have some awareness. In Dunn County, we've had over 1,600 people test negative for COVID-19. We are averaging about 175 tests a week. The state's metrics have us up at 625 to have adequate testing. We're not there yet. Looking at our cases, right now we have 20, and there has been a reduction in one case over the last couple days, and there's a story behind that. So we work with individuals that aren't securely housed. We also work with individuals that may not know where their county of origin is. But this most recent one, and so usually we're able to kind of clear that up within 24 hours, so it's not actually misrepresented on our website. But this last one actually was reported out of another state. And so there was a miscommunication with the reporting. They uploaded it as a positive case. And then when we received the actual web report from the provider, it was negative. And so that indicated that obviously we have a total of 20. As of, and this is as of 2 o'clock today, we have received notification from a provider that we have 2 new cases. And I'm working with Eau Claire County. I was texting back and forth during the beginning of the meeting. I probably shouldn't disclose that, that we are working a cluster that is likely to have additional cases here in Dunn County related to an adjacent county. So it's always in flux and very fluid. So what you see in the breakdown is whether or not they've recovered, and we're using the word released from self-isolation. And we have one person who's continuing to be hospitalized. We were hopeful that this person would actually be able to be released from hospitalization. And then after, I want to say almost 2 months, they had to have another test, a PCR test, to be released to a long-term care facility, and they tested positive. And so we're digging into that. There is a lot of conversation both nationally and statewide about this phenomena that you can test negative, and this individual did, and then test positive again, and whether or not that's actually a result of virus that can infect somebody or not infect somebody. And so we're still trying to figure that out, but because it would have the implication of a long-term care facility placement, we are erring on the side of caution at this point. And then we do still have 5 individuals that are isolating at home. I think that is where we're at. I think the other things that I have and I shared last month, and I think it's just really helpful to understand, is John Hopkins' situational report. So it breaks down Dunn County and some of the things that are to be of concern. So it gives us our population demographics, recognizing our age does skew fairly young because of Stout. We do have about 45% of the Dunn County population that has an increased risk associated with either age or underlying health issues, an increased risk for poor outcomes related to COVID-19. And then about a quarter of our population, or 27%, actually have 2 risk factors. One of the things that I think is really important for all of you to have awareness, and I know that you know this, but germs don't stop at county lines. We're working a lot of cases that have bleed over from adjacent counties. There's clusters in workplaces as well as in some vulnerable populations. I think it stands to reason, and I know that Chris sees this as well, is that folks that have barriers to positive health outcomes oftentimes have multiple barriers. And so we are working some cases that are very challenging. But Eau Claire has seen a significant spike. They've got, again, a cluster of illnesses associated with some essential workforce folks, as well as a cluster of illnesses that have impacted the region associated with folks that are insecurely housed and use illegal drugs. So that's impactful. And then these are our top 10 states as reported by the CDC. Just some awareness, Wisconsin is down much lower than many of these. Another thing that I have had questions and have shared information about is the Wisconsin Healthcare Association's, their portal on what kind of hospital readiness. And you guys will remember that this is one of the gating criteria for Badger Bounce Back is, are our health systems prepared to take on more COVID cases? And so the portal does give us a good rating, and I think that that stands to reason people, and I'll share this electronically because these are really tiny numbers. But this is a live website that they update in real time as well. So that's one of the things that I wanted to share, just to kind of bring you up to date on where we are locally. And then the other thing I wanted to share, you minimize that. My desktop always gives IT a little bit of heartburn, so we're not going to look at that. So this spreadsheet, oops, that's not helpful.
There you go.
Does talk about the gating criteria. So I've had a lot of folks ask, how do we know that the order that came out of my office that I penned last week is appropriate? How do we know if we need to continue that order? Or how do we know that we're ready to really reopen the economy in a full effect? And so gating criteria that we're using is downward trajectory of influenza-like illness. So we are watching this regionally. It's only been a couple weeks that I've been able to get the health system partners to break that down by Dunn County. because our health systems work regionally. And so we were working on regional data before then. And then looking at a number of cases, are we on a downward trajectory? Considering we had 6 cases a week before last, we are not quite there to where we say we have 2 weeks of downward trajectory. And then percent positive. And so when we look at percent positive, this is much easier on the statewide just because our numbers are so slow, or small, sorry, they're small. That the percent of folks that are tested in Dunn County, how many of them are positive? So we did have that spike a couple, like I said, a week and a half ago, but otherwise we're trending fairly low with a low number of cases. Other things that I'm looking at as far as decision making is whether or not my department can follow up and do contact tracing in a reasonable timeline. So we want to make sure that we contact positive cases within 24 hours of notification, and that we follow up with each of our case contacts. So anybody who's positive, if they've been in close contact for more than 10 minutes, closer than 6 feet, that we're talking to them within 48 hours. And so right now, even with the 6 cases in 1 week, including one that had 34 close contacts because they were associated with a congregate living center, we were able to do that. I think that when we see large gatherings, and by large I mean more than 10, but definitely more than 50, that's going to be very difficult on my department to adequately do the case contact tracing. So that gives you an update on where we are here and regionally. I'm going to go ahead and stop sharing my screen. All right, and then statewide, I think there's been a lot of media coverage about the Supreme Court decision. The Supreme Court really nulled the order based on procedure and based on the extent of the order. They left certain portions intact, including schools, and we had kind of talked about that a little briefly in advance of the meeting, that the order extended to June 30th, actually, for schools for in-person instruction. So that impacts not only this semester, but summer semester substantially. And then the order, even though the legislature, as I understand it, didn't ask for clarification on enforcement, the Supreme Court did weigh in on enforcement powers. And so that's really tricky to say that enforcement of the primary prevention strategies that have really worked to flatten the curve were outside of scope. What I want to share is that the statute that applies to the state health officer is different than the statute that applies to local health officers. And so local health officers' statutory authority is not called into question, but we are taking a more conservative approach to how we're moving forward with enforcement, not asking for enforcement on primary prevention, but asking for enforcement on reactionary or containment. So the order that I put out, the only language that says somebody must do something or uses the word shall is around having the best practices in place for their different types of businesses and locations. That will be enforced only after we have a cluster of illnesses associated with a business or a location or a group of people, first voluntarily, and if we can't or won't meet that need voluntarily, then we will use other means, using citation authority as well as cease and desist language and orders. So that is really independent. Also recognizing that we have separate statutes that require local health officers to abate human health hazards, including communicable diseases. So there's a lot of, I would say, statutory cover for enforcement after we have a known cluster of illnesses associated with a place or with a group of folks. Additionally, the state is putting out money. And so initially there was a lot of money that I think was going to be used internally to the state and the state operations in a concerted way. With the Supreme Court decision, there has been a reframing of how to use that money. So we received a notification yesterday and then again verbally today that money will be put out to locals. I received the first installment. You guys will remember that you approved last night kind of a broad range of dollars that we could be receiving for COVID-19. And that was $150,000. We have received 47,000 that came in yesterday. And then we got notification that we will get additional dollars, 30,000 for the work that we're doing around COVID planning. And then dollars on a different metric associated with testing and being a public health strategist about making sure that people that need to get tested do get tested if they don't have a medical home, if they have other barriers, and then additional dollars around contact tracing. And that contact tracing will be able to be used to support some of the LTE dollars or time that we've invested going back to March 1st. So that's really a positive support from the state to recognize that a lot of COVID-19 response is happening at the local level in Wisconsin. I feel like I just did a lot of talking. Any questions about any of that?
How many individuals constitute a total for a cluster of individuals infected?
So that's a great question, Supervisor Comrie. So there is two definitions, and it's tricky this way. So in long-term care facilities, a cluster is one person. And that really has to do with the real sensitive nature of the folks in that long-term care facility. So with other workforces and other groups of folks, it is two, non-household related. So we do not have a cluster associated with a business here in Dunn County, but they have them in several adjacent counties. The state has actually started making that publicly noticed on their website, and you can see by county the number of workplaces. If it is a long-term care facility, they will actually list the name.
Any other questions for KT? Supervisor Bjork?
Yeah, KT, question I have is when I enter a Walmart facility, the distribution center, whether it's in my car or truck coming to work or pickup or with a semi, and all inbounds are checked, have their temperatures taken, and answer questions as far as where you've been and been around anybody sick and everything like that. Well, I've learned that I have a 97 degree temperature just about all the time. And you said early on that if you're sick, stay home. What happens if I come to the gate and I have a temperature of 101 or whatever it is? Am I supposed to, I will not get, in the facility. What is my steps after that? Should I be calling Dunn County Health Department and get a test, or what do you do if you show up at work or any place and you have a temperature of 101?
Sure, so that's a fantastic question. So many of our industrial partners that have been what they called essential businesses and have been open have really integrated the WEDC or WEDC guidance. And so that does include screening like you're explaining. It also includes some of the sanitizing and disinfecting and the physical spacing, all of those controls we've talked about now for 3 months. What I would expect to happen is that your workplace, as well as the workplaces that are opening, screen. And when someone fails that screening criteria, meaning they have been exposed to COVID-19, they've been in close contact with somebody that's been tested positive, or they have a fever of 100.4 or better, or they have any of the symptoms of COVID-19, that they're actually excluded. And they can be excluded and encouraged to contact their medical provider via telehealth or over the phone to walk that through with that provider. And I know that Chris can chime in. We're working for some guidance for our own internal workforce to make sure that we're keeping our workforce as well as the people coming into the county building safe, using very similar criteria like what you're explaining with your workplace.
Any other questions of KT? Thank you very much. A very helpful update. Moving on, Department of Human Services staff report. Am I turning this over to Chris or to Christine?
Well, a little bit of both. Let me just lay a little bit of a foundation to what I've asked Christine to do today. So obviously there are COVID related repercussions, you know, across the board in every particular, in everyone's lives. However, from a Department of Human Services standpoint, we're obviously concerned about the population of people that we serve. And one of the areas that sort of crosses into a lot of different people's lives throughout Dunn County is in the area of economic support. So food share, Medicaid coverage, child care services, heating and energy assistance, those programs that we provide that provide economic assistance to folks who are in need. And so there have been a number of substantive changes in that program over the last few months related to COVID. So I wanted to take this opportunity to have Christine, who's the manager of the economic support section, both do a little bit of background about the structure of economic support, as well as some of the changes that are pretty significant given how restrictive some governmental programming can be. So let me get to her here, and she put together a delightful PowerPoint for you, and she's going to walk you through that.
Okay, so, oh, you have my screen up.
I do.
Well, then will I have control over it? Let's see.
No, you'll have to tell me to move it.
Oh, I was ready to share mine.
Oh, okay. Can you?
Yeah, I can share.
If you can share, then I'll stop. You go ahead.
Okay. I've Zoomed before.
Yeah, partying.
I know, right? Here we go. Share. Okay. You should be seeing a screen that says economic support section. Is that sure? Have you seen that? Okay. So we are the economic support section of Dunn County, and I guess I have to have this page up to move them. And we are part of the Great Rivers Income Maintenance Consortium. The local staff here at Dunn County I am the section manager, and I have 2 lead workers. One oversees the family team and the child care team, and one oversees the elderly, blind, disabled, and long-term care team, as well as the home energy assistance program. I have the staff listed there so you can see the size of the positions, how many positions we have. The Great Rivers Income Maintenance Consortium is a partnership that was established in January 1st, 2012 between the counties of Barron, Burnett, Chippewa, Douglas, Dunn, Eau Claire, Pierce, Polk, St. Croix, and Washburn. Eau Claire County serves as the operational lead county for the consortium. So that means that they hold the contract with the state of Wisconsin for the consortium. They are also then the main fiscal agent of the consortium, and they hold the contract with the other 9 counties that participate voluntarily in the consortium. They facilitate the meetings of the directors, and they facilitate semi-monthly supervisor manager meetings, as well as all of the team meetings, and they are responsible for the oversight of the operation of the call center. The GRC teams, as we like to call ourselves for Great Rivers Consortium, we call ourselves GRC, is the Human Services Directors, and there's 10. There's 1 from each of the participating counties. The management leadership team are the supervisors and managers like myself, and there are 12 of us. The lead worker team has 15 lead workers, and they are split where we have 9 of them assisting family workers and 6 assisting the EBDLTC workers. Now, these are throughout all 10 counties. Like Eau Claire County has 3, we have 2, some have none, so it just depends, but we pool them so they all work together. Our family team of workers, there's a total of 102 line staff, and we split them up to have 40 work with the families and single individuals. 29 work with the elderly, blind, disabled, and long-term care team. 19 are on what we call the child care special team, but they also help out on family team and EBD team, so they have some of those cases. And then benefit recovery staff, we have 14 staff dedicated to that, but they too also help out on some of the other team actions. Our call center that we operate Monday through Friday, so 5 days a week, has 3 different queues in it that callers can call into. One is the general queue, and that takes family team and childcare staff that. And childcare, which is a separate queue that people dial into, only obviously the childcare team staffs that. And then again, the elderly, blind, and disabled or long-term care team staffs their call center. So each one of them have questions that are specific to their different categories. The lead line queue is there only to assist the agents. They don't take any calls from customers, but if the agents are on a call that is difficult or they don't know an answer to a question, they can contact the lead line while they're on the call and get help right away. The programs that the entire consortia and our local county administer are the food share program, which is called SNAP nationally. That's Supplemental Nutritional Assistance Program. And just a little, you'll hear all of the details when you get the annual report, but just to give you an idea, in Dunn County, in 2019, the average monthly amount of food share benefits was just about $343,000 per month. So that affects our local economy quite a bit. We have healthcare programs, both for the Medicaid, which are the elderly. They may be needing help in their home, elderly, blind, disabled adults and children, or they may be in a communal living situation like a assisted living center, or they could be in a nursing home like the neighbors. The other major healthcare program we have is Badger Care Plus, and that covers children, parents, childless adults, and pregnant women. And there are way too many income limits to go by, to tell you who would be in what group. But that's the general populations that program covers. We also have child care assistance, which is obviously what it means. It's to help people to pay for child care while they're working. We operate a program integrity programs. One is quality assurance, which our leads and supervisors check cases. The state also does second party case reviews. That's to make sure that we're processing cases correctly. And we actually did get our county, as well as our consortia, did get awards for having the lowest national scores in that area. So that was great. Benefit recovery is obviously what it means. It says it means that anybody who made a mistake on their case, whether it was intentional, which is fraud, or if it was an error that a worker made or a systems problem, we work to recover those benefits that were incorrectly issued to someone. And lastly, just in Dunn County, we issued the Wisconsin Home Energy Assistance Program. That is not, every county has this, but it is not a part of the Great Rivers Call Center or the Great Rivers Consortium. The pandemic policy changes that we saw actually started happening in March. And what the state and the feds did what the state did was reaction to what some of the federal programs were, and also just some of what we needed here in the state. They continued the benefits during the pandemic. So what that meant is that March, April, May, and June renewal reviews were pushed out 3 months. Then the March, April, May, and June 6-month report forms that are required were removed and are no longer required. The verifications that folks have to turn in were waived until the health emergency ends for the programs. The food share interview requirements were waived for applications until May 31st. And drug testing of drug felons was also waived until June because of the in-person problem. There's no way to do drug testing without being in the same room. In a specific program, we saw a lot of change in the child care program. And you probably heard about some of these on the news. The providers were capped at the number of children that they could have, with the state urging providers to focus on serving those essential employees, the ones that working in essential jobs. The authorizations were held open so that there was no problem with paperwork. The focus was on keeping the providers in operations. So parents were told to issue funds to providers even if the kids weren't attending. And those that didn't, DCF, the Department of Children and Families, did an auto issuance to make sure that the providers got those payments and they could stay solvent so that they'd be there when the pandemic's over. In Badger Care and healthcare, the whole healthcare program, eligibility had to continue for anybody who was eligible as of March 18th or became eligible thereafter until the health emergency ended. From April forward, all premiums for Badger Care and the MAP program were suspended, and anybody who had paid one in April was refunded that premium. The restrictive re-enrollments, and that meant somebody that didn't pay their premium that should have, those were also ended, and those people were put back on eligibility. In the child as adult policies that had been enacted in the spring were stopped. They suspended those. So that along with the premiums, there was a work requirement and a health survey that was required to be answered, and they suspended those too. Under the food share program, this was probably one of the biggest changes that we saw that were most impactful. Emergency benefits to bring a household to the max allotment for their group size for the months of March, April, and May were enacted. We had a story early on in March, and you probably all remember when with the pandemic, shopping of hoarding toilet paper and other canned goods and flowers. We had a little couple called, and it was sad. They were really concerned because they didn't have enough money on their food share card to go to the store and stock up, and they were afraid that food was going to be gone. Well, I think that the state and the feds heard that. Sorry, my light went out. Heard that, and this was the response, is to increase the number of food share benefits. They also looked at, issued a program called Pandemic EBT for March and April and May and June for the school-age children. Those kids that were getting free and reduced price lunches at school were now in the homes. And even though the schools were providing lunches that people could come and pick up, that wasn't always possible. So they across the board just issued benefits to each home that had a child that was registered to get free or reduced price meals through the schools. If they were open for food share, they did put it on their Quest card. And if they weren't, they issued a special card to each household for the kids under their care. So it didn't matter if they got food share or not, they still got this card. They didn't have to spend it. They have up to a year to spend the benefit. And if they choose not to, they can just, get rid of the card and the benefits will be expunged.
Chris?
Yes.
Could you just pop back, Fred, to that screen for just a second? I just wanted to have you talk with the group a little bit about the practical implication you and I had spoken about. So for instance, the healthcare eligibility continuing
Oh,
for
yeah.
anyone that was eligible or became eligible afterwards. So I had shared with you that my daughter is employed in the service industry and was laid off on March 23rd, I believe it was, at which point she would have had zero income after that. Now, she was eligible for unemployment eventually, but at that point in time, she would have met, as of like April 1st, she would have met the eligibility criteria for healthcare. And then even though she received unemployment, she would continue to qualify for healthcare throughout the remainder of the healthcare emergency. Correct?
Correct.
Yep.
She would have. What the impact of all of these pandemic policy changes are is that these reviews are pushed off 3 months. The no interviews, no verifications. All it does is push our work down the road. So in a few months, we will have, like I explained to Chris, it's going to be a swell of reviews that we have to do. This is just like when the ACA came into play, and many people, we had thousands apply for that. And what we ended up with is a year after the very first enrollment period, when people started getting eligible in the month of March, the following year, we had like 9,000 reviews due for our consortium. Now there is 10 counties, but 9,000, we have 100 staff. It was crazy. So they had to push some of that work off. This is probably going to be about the same way. So the state is working really closely with our leaders, that the operational lead, like Eau Claire County, that attends the monthly meetings. They're working really closely with that group to try and figure out how we get this work done, because it has to be done, but how do we do it over the summer when most staff want to take vacations? There's no good time to do this. So,
and then the other practical piece is if you could just talk a little bit about that emergency food share benefit going to the maximum allotment,
right.
what that meant for a lot of, like, for instance, if you could just give the example of a single person
Yes.
who had been.
If a single person had been eligible for $100 a month, when they raised that up to the max, which is, I'm sorry, I think it's $194 right now. What that meant is that they gave them that extra $94 for March, and then again for April, and then again for May. So now they've had $600 when they normally would only have $300 to buy food with, which is fantastic for them. But come in June, if they don't do that and they stop that practice, because now we are open back up and people are working, they may not do that in June. We're going to take a lot of phone calls because people will have come to expect that higher allotment. That is my opinion, but it's based on fact that has happened in the past when they've done things like this. So,
and the practical piece of it is that many people in that single category were receiving like $16 or $17 a month in food share benefits, and now they've gone to $194.
Wow.
Yep.
And then it will go back to the $17.
Yeah. So we anticipate a lot of phone calls based on that. We've had a number of phone calls around the pandemic EBT. Those calls are supposed to go to the schools, but they're coming to us, and then the schools are calling us saying, why are you telling them to call us? There was a disconnect between the state and the schools when they asked for we don't keep track of the kids that are on free or reduced meals. The schools have that information. So it's their lunch programs that have to report that. So
but right now the school programs, my understanding, at least at Boyceville, we are feeding kids that are, the free and reduced is not holding us to who we can feed.
Right. And this program is only for the free and reduced kids. The school can feed anyone that attends the school. That's a whole different program. And as I know, you guys aren't charging for that, right? Okay.
No,
And
we're not.
yeah, they're doing this, I think, to help ease some of the tensions in the household. Now, if you've got 3 kids that, you know, now you're being the teacher, the mom, the dad, the breadwinner, and now you got to feed them somehow. So
What do you think is going to happen? Because our food program will go through June through the schools.
right, that's what they
After
do.
that, it's gone.
Yeah, we don't know. We don't know if they'll extend it. I think a lot of it could change if the feds do something again. If we see another Families First or another CARES Act type funding bill. Some of these came in response to that. The state asked for the help to get these families help, because these also went to people that didn't have any food share benefits. So typically kids that get the free, their families are probably already getting food share benefits, but the reduced price, not all of them are. Many of them don't want to apply for a food share because of the stigma.
Yeah.
So. Okay, what this shows is, you might be wondering if they've pushed all our work out for 3 months, what we're doing. But what this graph shows is we did a comparison between March 1st to May 4th of the number of food share applications that we took in 2019 and in 2020. And in 2019, for that same period, we had 5,844 applications. And the gold line is 2020, and you can see that we had 7,087, with one of the weeks topping almost 800 applications. That was closer to probably the 3rd week in May, or in April, sorry. So that swelled our applications and made people be really busy. On the other side of things, our healthcare applications for that very same period, you can see that between 2019 and 2020, they were pretty much intertwined. But at the end, 2020 has really dropped off. And I attribute that to the fact that nobody closed. There were many people that were carried, they could not close. So some of we call it churning. They close and reapply, close and reapply. That keeps our numbers pretty consistent. But because they weren't closing and reapplying, our applications were actually down by about 400 applications for that same time period. I put data here for our general queue only of the phone calls. You can see this is our call center data, and it does have 4 years worth, but the yellow line is the 2020. And you can see in January, we just had under 16,000 calls for that month. In February, it went down a little bit. In March, it stayed about the same. In April, it dropped. And again, I believe that the reason that it dropped in April is because many, many people were just given notices that they were going to remain eligible. There was food share being put on their cards. There was nothing being asked of them to turn in. So it really reduced the number of calls that we had. Our answer rate was over 96% for March and at 99% for April. So we'll see what happens when we restart everything in the month of June. Now, I don't know if Chris wants to talk about this or if I'll read through it. She can chime in when she wants to, but in order to do income maintenance programming, we have costs that include salary, fringe for staff and the managers, supplies. You know how budgeting goes. But in addition, we're also able to claim as an expense a small portion of other county costs, such as facilities, IT, corporation counsel, administration, even though that DHS doesn't directly pay for those expenses. Our contractual commitment to the Great Rivers Consortium is to maintain the level of staffing necessary to complete income maintenance work as determined by the workload. So generally what this means is we agree to maintain the same number of staff from year to year and only reduce if the workload across the whole consortium reduces. And then we work together to determine where that reduction should happen, or we increase if there is additional funding. The amount of county levy that was budgeted in 2019 was $488,031. In 2019, because Great Rivers was able to access additional federal funding that had nothing to do with COVID, but it was just additional federal funds, the consortium was able to cover the entire $488,000 for Dunn County. In addition to that, because of that ability to claim the small portion of indirect expenses, we not only didn't cost any county levy, but we were reimbursed $78,000 towards the indirect costs. At the end of the year, that additional reimbursement either adds to any monies that DHS returns to the general fund because we were under budget, or it helps to offset any overspending in the total DHS budget. Simply stated, if we had stopped doing income maintenance in 2019, we would have eliminated 14 fully funded, fully benefited county positions, disrupted many essential services to Dunn County citizens, and we would have foregone the $78,000 in funding that will go to offset overall county operations. Do you have any questions? Or Chris, do you have anything to add?
Nope, you did a great job.
Any other questions? Thanks very much, Christine. That's very helpful.
I want to thank you all for your support too. Okay, I'll end sharing. There you go.
All right. I just want to bring your attention to, I sent this out in an email to you today. I'm not going to take the time in this meeting to go through it because it's relatively self-explanatory, but I wanted you to have an opportunity to sort of see what some impact has been in the last, over the last few months in terms of some of the numbers of services, some anticipated, some not anticipated. So you can read that at your leisure. It was in an email today. And then Sarah will do a quick update on the our financial report.
And Sarah, thank you, if I may. We did get financial reports in our packet and they're excellent. So maybe hit the highlights.
Okay. Do you want me to do a screen share? Does everybody have their stuff?
You can do a screen share.
Is it centered and okay?
Yep, looks good.
All right. So what we have right here, I'm just going to highlight on F right now, just to make this quick because everybody's got a copy. The grand total projected expenses for 2020, if we continue to spend the way we are, we will be at $13,233,342. That includes salary, fringe, and operating. The next two cells below divide out the operating and the salary. Divided out, our operating is $8,115,372, and our salary is $5,117,971. Then it foots back to the budget of what our projection is. Our revenues are projecting that we'll have, if we continue to get the funds that we have right now, we'll end up at $9,624,907. This is over what we anticipated and budgeted. We budgeted the $9,556,345. So with the end of where we are right now, it looks like we will use $3,608,436 in county levy, which is less than the budget of the $4,096,708.
Excellent.
So I would just say we're still early in the year. It's only, these would account for expenses through March. And so it's a little early to start spending it yet or celebrating or whatever we would choose to do with it. However, what I would say is that, and I said this in the information regarding our agency's preparations for COVID as well, but you know, as Greg indicated, we're not traveling anywhere, we're not going to conferences, our staff development costs are virtually nothing. Additionally, we're not traveling for to go to see consumers. Many of the services that people have been able to access are being delivered remotely. So even if they're receiving services from another provider, that's happening virtually. And so there's no travel to that. And our revenues so far have not been significantly impacted because we are able to a lot of the requirements around the ability to bill for telehealth or remote delivery of services have been relaxed, and so we're able to continue to bill at our standard rate for all of the services that we provide. So far the pandemic has not had a significant impact on our financial situation. In fact, it's probably been more positive than negative.
Interesting.
Does anybody have any questions on the financial presentation?
Yes, Sarah, this is Gary Steen. Can you hear me?
Yes.
So based at where we're at right now, where are we at?
I don't know where you are at, but I'm still at the work. Did you want the calculation as far as?
Well, are we, you tell me where we're at as far as plus or minus at this point in time. I realize this is an early snapshot of where we're at, but if things went along the way they look, where we're going to end up.
That's in this column right here, and it looks like we would give back $488,272 of county levy if everything stays status quo the way we are right now.
Okay. And thank you. I got it in front of me, but I needed you to tell me.
That's okay.
And just for Diane or our chairperson's information, that Sarah has been very good about putting us where we're at. We've had some bad years in the past, and we like to, at least I do, like to know monthly where we're at.
Oh, absolutely.
In relation to where we're going to end up. Of course, our payment system it lags by 2 or 3 months. So our income is not always up to date. Am I correct in saying that, Chris?
You are. We take that into calculation in our projections, but it is true. So if you think about it, we deliver services in January, we bill for them in February, and we receive the payment in March. So as we sit here in May, we really would have only received payment for January and February services. Now we do calculate that in a projection, but it's less than perfect. Similarly, when we when we're providing services, we provide services in January, and the providers send us a bill in February, and we pay it towards the end of the month. So usually our expenses are a little closer, but they're about a month off, and we take that into consideration, but it's a less than perfect calculation.
Well, thank you, Sarah. Nice job.
You're welcome.
Just keep us in the plus column if you can.
All right, I will.
Yeah, thank you, Sarah. These are really excellent data and very helpful. I spent quite a bit of time today going over them, and I appreciate this very much.
Thank you.
That's it that I've got, Diane.
Thank you. Thank you, Christine and Sarah and Chris. Helpful report. We have 2 action items. A review of March and April DHS vouchers paid. You have that information in your packet. Is there anything of significance there, Chris, that you want us to note?
Nothing I'm aware of, no.
If not, without objection, I'll entertain a motion to note review of both months, March and April. Supervisor Steen, is there a second?
I so move.
I'll second.
I saw Bonnie Barker's hand
Okay.
up first.
That's
We
fine.
have a motion, a motion and a second to note review of the DHS vouchers for both March and April. All in favor?
Aye.
Aye.
Any opposed? Vouchers are noted. Second action item is DHS and public health budget adjustments. You also have that documentation in your packet along with the justification. I think these need to be voted on separately.
That's probably best. They're in the same document, but separately is fine.
It felt to me as if we needed to act on them separately. So I will need a motion on the DHS. Apparently I can still talk budget adjustment.
I so move.
Supervisor Steen, is there a second?
I'll second.
Thank you, Bonnie Barker. Any questions? Any discussion? All in favor?
Aye.
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 All opposed? Budget adjustment for DHS passes. And for public health, I need a motion and a second to approve the budget adjustment.
I so move.
Supervisor Steen, second.
I'll second.
Bonnie Barker, thanks very much. Any questions? Any further discussion? All in favor?
Aye.
Any opposed? Budget adjustment passes. Unless, yes, Supervisor Steen.
I have a question as it relates to Dave maybe. And what we did last night, Dave, at the county board meeting to allow the departments to process their reimbursements for COVID money. These health budget adjustments are more normal. Am I understanding that correctly?
That's the way I would, that's the way I would understand it. Yes.
Yeah, okay. I just wanted to make sure about that. Thank you.
So I can give you a practical, I know I heard the discussion last night. Let me give you just one quick practical example of the COVID related money. So there was a grant application that came out this week. It came out on, what is today? Thursday, Tuesday. It's due next Friday. It's on the behavioral health side, and we're going to write it for about $21,000 worth of technology telehealth equipment. It has to be spent by September 30th. So by the time that we take it through the process, they award the grant sometime in maybe June or so. If we took it through the current process and there's not county board meetings, in some months and whatever, it would really tie our hands to be able to access that money. As it is, we'll be able to replace out about 8 laptops and some printers and some things that we had slated for spending as capital expenses for next year that we actually will be able to fund with the COVID money from this year. So that's a practical example of how the timing can be significant.
I appreciate your explanation, and I'm Norwegian, so I just want to make sure I understand what the heck I'm doing here. And congratulations on a very good meeting there, Chairperson Morehouse.
Yes.
Well, thank you, Supervisor Steen, and thank all of you. This is going to be a good committee to work with, and I'm really excited to be here. Any notes?
Can I just ask one question, Diane?
Certainly.
Dave, I have my 2 citizen member per diem sheets. Can I just send them through to you without a signature?
Yes.
That's okay. Because I can't collect their signatures. Well, I could, but it's cumbersome.
Supervisor Bjork.
I just have a question, going back to my workplace. I found it really interesting that they seem to have the ability to have an instrument on a tripod that can take your temperature and you're 10 feet away. You don't have to hold something to your forehead. Does Dunn County have that kind of equipment?
We have one that'll take your temperature for 1 inch away.
The quick answer is no.
I think the answer is no. Are there any additional questions, announcements? Chairman Bartlett?
I had a question going back to the vouchers. I didn't want to interrupt you when you were rolling along so good there. But it's under family and child grant. There's a expenditure from Quick Trip Incorporated for $1,260.
What month is that, Chairman Bartlett?
And anyway, my question is, was that for fuel or for food?
That was for gas cards.
Gas card.
So instead
to individuals.
For individuals.
Thank you. Understand then.
Okay, then, any announcements, any further business? Thank you all very much. Without objection, we are adjourned.
Well, thank you.
Thank you.
Thank you.
Goodbye,
Stay safe,
everybody.
everybody.
Stay healthy.
Yeah, stay healthy.